Chaitra, you can start now.
Okay, sir. Om Shri Dhanvantare Namaha. Om Shri Gurudevaha. Good evening to one and all present here. I would like to start the session with brief introduction about Jignasa and the program. Jignasa is a pan-India initiative exclusively dedicated for Ayush students and Ayush education system. With the aim of safeguarding the health and understanding the medical methods and theory that comes under Ayush, Jignasa implements various student-oriented and society beneficial activities with its motto, Learn Ayush to Practice Ayush. Today, Ayush is gaining prominent portion in the global health system. So there is need to empower our education system towards this global challenge. For this, Jignasa is trying to bring together the medical students, teachers, doctors, and administrators of Ayush system together in order to bring the desired changes. In ancient India, young seekers would approach learned sages with one burning desire to acquire knowledge and excel in their chosen path. The sages, in turn, would not only teach them but also prepare them to apply their learning effectively in real life challenges. Inspired by this timeless tradition, Yashasvi Bhava, prepare, perform, prosper, has been designed as a beacon of guidance for second prof BMS students. This program is our modern day Gurukul, a comprehensive exam oriented series tailored to help second prof BMS students master every subject with the support of expert professors. With features like dedicated doubt solving sessions, model question paper practice, and daily classes aligned with CBDC curriculum, Yashasvi Bhava ensures you are not just prepared but empowered to excel. Let's begin this journey of preparation, performance, and prosperity. It's my honor to introduce today's speaker, Dr. Mamatajbegaum Walikar ma'am. Ma'am is currently working as Associate Professor, Department of PG Studies in Roga Nidana evam Vikriti Vignanam. Ma'am has a 10-year experience of teaching and presented papers in national level seminars and also gave 3 radio talks on Akashavani, Dharwad and 1 KLE Namadvani, Dharwad. I welcome you, ma'am. And now I request you to start the session, ma'am.
Thank you, ma'am, for your wanted. Am I audible?
Yes, ma'am.
Yes, ma'am, you're audible, ma'am.
Ma'am, you can even on your video if you're comfortable, ma'am, so that audience can see you, ma'am.
Okay. Is it okay?
Yes, ma'am,
Yes, ma'am. Yes, ma'am. It's perfect, ma'am.
Shri Gurubhyo Namaha. Good evening, one and all present over here. Myself, Dr. Mamatajbegaum Walikar, Associate Professor from the Department of Roga Nidana evam Mahavidyalaya, Hubli. Today's exam orientation lecture series for the second professional BMS students, that is competency based curriculum, that is RS7 batch. So today's my topic is Roga Nidana evam Vikriti Vijnanam Paper-1. So first of all, I would like to give tips for our students. So first and foremost is be cool-minded. So read and understand the questions properly before you attempt any question. So be specific about what you write in your answer booklets. Then write shlokas wherever applicable. Use technical terminologies, not layman language. So this CBDC RS7 batch has Roga Nidana batch has 2 papers, that is Roga Nidana 1 paper and Roga Nidana 2. Each carries 100 marks. So total theory marks will be 200. And practical, we are totally having 200 marks. In that, 100 marks for practicals and Viva 70 and internal assessments will be 30. So totally in Roga Nidana paper, we are having 400 marks. So this is a question paper pattern as per the NCISM, that is multiple choice questions 20, Short answers will be 8, long answers will be 4. So for 20 marks, there will be 1 mark. So total marks will be 20. Short answer questions, each carrying 5 marks. So totally there will be 40. And long answer questions, there will be 40. So in total it is 100 marks.
Sorry to interrupt, ma'am. The slides have not changed on the screen, ma'am.
Not changing.
Kiran, slides are not changing, right?
Ma'am, please change slide once, ma'am.
Can you see?
Like we are able to see only the first slide, ma'am. After that, we didn't see any slide, ma'am.
Yes, ma'am. Now it is visible, ma'am.
Yeah, ma'am. Now you can start with the PowerPoint, ma'am. PowerPoint mode, it will look better, ma'am.
Is it changing?
Did you start with the PowerPoint mode, ma'am? Hello, ma'am. Is the voice audible, ma'am?
Yes, ma'am.
Ma'am, now we are able to see this one long answer question. That slide we are able to see, ma'am.
That slide is visible?
Yes, ma'am. Fifth slide is visible. Yes, ma'am. Yes, ma'am. You can continue, ma'am. You can continue now, ma'am.
My slides are not changing, ma'am.
Can you go to sixth slide, ma'am? Sixth slide.
Is it okay now?
Now it is paper-1 syllabus. Yes, ma'am. Yes, ma'am. Now it is changing, ma'am. Now it is changing, ma'am.
Okay.
Okay, ma'am. Now we are in question paper pattern slide, ma'am.
Yes, ma'am.
Yes, ma'am. You can continue, ma'am. You can continue.
Photo. Video is not visible, no, ma'am?
Yes, ma'am. Video is not visible, ma'am.
Now?
Yes, ma'am. Now video is also visible, ma'am.
Okay. Slides are changing?
Slides are changing, ma'am. Please go to PowerPoint mode, ma'am. PowerPoint mode.
Is it okay?
Yes, ma'am. Yes, ma'am. You can continue, ma'am.
The question paper pattern from NCSM is MCQ 20. Each carries 1 mark. So totally there will be 20 marks. Short answer questions, 8 will be there, each having 5 marks. So totally 40 marks. And long answer questions will be 4. Each carries 10 marks. So totally 100 marks paper will be there. So, but as per RGHS, there is slight change has been mentioned. That is, they are giving long answer questions first, then short answers and MCQs next. So in MCQs, we are having 20 marks. In that, the questions will be from must to know are 15 and 3 are from the desire to know and nice to know. We are having 2 questions. But in short SAQ, there are the questions of MCQ, 7 questions will be there. Desire to know 1 and nice to know, no questions will be asked. From long answer questions, all the questions must be taken out from the must to know compartment. So these are the paper 1 syllabus points which are mentioned in the syllabus copy. That is, first point is Roga Nidana pathophysiology and clinical diagnosis. It will be having 5 marks. And second point will be pariksha, different types of parikshas, that is 16 marks. In this, all the questions have been asked, that is LAQ, SAQ and MCQ. And in third, this thing, methods of Rogi Pariksha. This also includes all the questions. Then Sapeksha Nidana is also having 15 marks totally. We can ask in for LAQ, SAQ, and here no MCQs are given. Then fifth point, Upashaya and Anupashaya. Totally there are 6 marks will be asked. Here no MCQ question has to be asked. SAQ and MCQ are asked. No LAQ question is going to ask. Like this, the NCISM has given specific points regarding each of the question. So these are the things we need to go through. So I request all the students to go through the syllabus points, read them properly and understand them properly. Then you can start reading. Long answer questions. There will be 4 points, syllabus points have been mentioned. That is pariksha, methods of Rogi Pariksha, Sapeksha Nidana, and Vyavachedaka Nidana. These 4, from these 4 points only, first questions will be asked. That is, long answer question is taken. Next is second long answer question. The points, syllabus points which are mentioned are Dosha Vikriti, Dosha Gati, Roga Marga, Shoto Dushti, and concept of Ama. And in third LAQ question, the questions will be taken out from the Sthana Samshaya, Purva Rupa, Dushya Dushti and Samprapti. And in fourth LAQ, Vyadi, Vyadikshamatva and Dhatupaka. So like this, there are the specific syllabus points are given for the LAQ questions. So now I will discuss how it should be written for the 10 marks pattern. So whenever we are writing 10 marks questions, so we should have some points. That is, any sort of topic we can take. First, it should start with introduction. So for example, I have taken parikshas. That is, Roga Madhav Parikshe Tato Anantaram Aushadam. So what we have to do here is, we have to write about what is the definition of pariksha. The next is pariksha karinohi kushala bhavanti. Like this, if we mention the shlokas, so shlokas are its meaning, it is easy for us, the evaluator, to go through the points. Then the point which has been mentioned is different types of pariksha. That this is very important. The flow chart and presentation skills are very important. So in this, we are having 2 different types. One is Roga Pariksha and another is Rogi Pariksha. Roga Pariksha is done with the help of Nidana Panchakas. So we can write Roga Madhav Parikshe Tato Anantaram. After that, we can go for Roga Pariksha. That is all the Nidana Panchakas name. The next point what should be given is Rogi Pariksha. According to different acharyas, there are different methods have been mentioned. That is Dvivida, Trivida. In Trivida, we are having 2 types. That is Darshanadi Pariksha and Pratyakshadi Pariksha. Then Shadvida Pariksha has been dealt or told by Acharya Shushruta. Ashtasthana Pariksha has been told by Acharya Yogaratnakara. So like this, we have to enlist the different types of parikshas which has been told by different acharyas. Next, explain the parikshas specific if asked. So for example, if the question has been asked for Darshanadi Pariksha, we have to write specific answers which are related to the Darshanadi Pariksha. In Trivida Pariksha, Darshanadi Parikshas have been explained. Darshana, Sparshana and Prashna Pariksha. So in this only specific answer to that question. So what are the points related to Darshana Pariksha? What are the points related to the Sparshana Pariksha? And what are the points related to the Prashna Pariksha has to be elaborated very neatly. So if suppose Ashtasthana Pariksha has been asked, so we have to write about all the 8 types of parikshas, then we have to elaborate each one of the type. So after that, we have to go for the importance of that pariksha. Then we have to discuss why these different types of pariksha has been explained. So that we have to discuss in 1 or 3 points. Next, we have to conclude that whole 10 marks question in brief. We have to give our own opinion in this conclusion part. Then if that question only if it is asked for 5 marks, then we have to shortcut that answer. That is, we have to write for definition, then we have to just enlist the different types of parikshas. Then we have to we need not to explain about any specific parikshas if it is not asked. Then we have to discuss about different things and conclusion we have to draw. So this is one example or how we can frame answer about SAQ question. That is, first we have to write about introduction part. Then if possible, try to write and the shlokas. So with reference, it is well and good for the evaluator. So one or two shlokas of definitions, then Samanya Lakshanas, if they're in that particular thing, then these are the things to be explained. So next, second topic is methods of Rogi Pariksha. Here also we have to give some introductory part related to the Rogi Pariksha. Then different methods of Rogi Pariksha has to be explained. And the very important aspect of this is importance and clinical interpretation of that Pariksha has to be elaborated very neatly. So if you take Nadi Pariksha, yes, what is the importance? What is the definition of Nadi? Then different types of doshik pradhanyata of Nadi. Then why we have to go for Nadi? How it is applicable in the clinics? That has to be write down very properly. Then next, Mudra Pariksha. So we must write here the Taila Bindu Pariksha, which has been explained by Acharya Yogaratnakar. So what is the prognosis of that Mudra? What are the evaluation based on Doshagati, right? So the prognosis of the disease will be best understood in the context of Mutra Pariksha. Then in Mala Pariksha, we have to go for Jalanimajjana Pariksha. So to know before administration of any Snehapana, we are doing Mala Pariksha. So that is Jalanimajjana Parikshas. To know about the Sama Mala and Nirama Mala, we are examining the Mala. So this is how we have to write methods of Rogi Pariksha for the 10 marks. Then if that question is only asked for 5 marks, we have to short it in these headings. The next topic is Dosha Vikriti. Right. So there are different subheadings are this under this topic. So one is Hetu, second one is Agni Dushti, and third one is Avarana. So if Hetu is asked for 10 marks, so what are the point we should cover? First and foremost is introduction about the Hetu. That is, it is one among the Nidana Panchakas. Nidanam Purvarupani, Rupani, Alpa. That we have to explain. Next is definition of Hetu. That is, Tatra Nidanam Karanam Ityuchyate. One or two shlokas related to the Nidana we have to explain. Like Tatra Nidanam Karanam Hi Uchyate. Next, Vadi Nishchay Karanam Nidanam. The things which are definite causative factor of a disease, that we are calling it as Nidana. Then the difference between Vyadi Janaka and Vyadi Bodhaka Nidana. So what is Vyadi Janaka? Hetu means we have to elaborate about each of the Nidanas, different types of Nidana. So Vyadi Bodhaka Nidana means we have to explain about the Nidana Panchakas, Nidana, Purvarupa, Rupa, Upashya and Samprapti. So this is the difference between Vyadi Janaka Hetu and Vyadi Bodhaka Hetu. So what are the synonyms related to this Nidana that we have to elaborate? That is Hetu, Nimitta, Ayatana, Pratyaya, Karta, Karanam, Karanani Paryaya. That each of these words are having different meanings that has to be written for the 10 marks. Next, what can be written is enumerate and enlist different types of Nidana. Here we have to give a flow chart. So if evaluator see the flow chart, so yes, it is correct. For example, 4 types of Nidana. What are those Nidanas? Sannikrishta, Viprakrishta, Vebhichari, and Pradhanika. So there only we have to elaborate the things. Then 3 types of Nidanas. That is dosha hetu, vyadhi hetu, and ubaya hetu. Another classification of Nidana is Asatmendriyartha Samyoga, Prajnaparada, and Parinama. This we need to elaborate properly. So, what do you mean by Asatmendriyartha Samyoga? With examples, Hina Yoga, Mithya Yoga, Ati Yoga of all the 5 Jnanendriyas, we need to elaborate properly with examples. Then, Prajnaparada. So, Prajnaparada stands for the Dhriti Smriti Brashta, Karma Yat Kurote Ashubhamam. So this shloka we have to mention. Then we have to elaborate the Prajnaparada Janya Vikaras. Then next one is Parinama. So Parinama Kala Ituchate. So we have to write Ati Yoga, Yoga, and Mithya Yoga of the Parinama or the Kala. Then next classification will be 2 types of Nidana, Bahya and Abhyantara Nidana. Next comes is Anubandha and Anubandha Nidanas. Next, very important classification is Ashayapakarsha Nidana. So, these are the things or these are the points which we have to write in flowchart. Next, we have to discuss about the Nidana and we have to give our own conclusion points. Then next I have taken is Agni Dushti. If it is asked for 5 marks, we have to write about introduction. So in introduction, we have to give important of Agni. So what do you mean by Agni? That we have to write San Ayu, Varna, Bala, Utsaha. All these are the factors are depends on the Agni only. If Agni is healthy, so all the states will be healthy. So there are different types have been explained, that is Mandagni, Tikshnagni, Vishamagni, and Samagni. So here we have to explain each Agni specific Lakshanas have been mentioned by each by the Acharyas. That is in Mandagni, Alpe Upayuktam Annam Mahata Kalena Pachati. That it takes if little quantity of food has been taken, it will take a longer period to digest. So this we are calling it as Mandagni. So if you write the 1 or half line shlokas with proper meaning, so that topic will be very easy to understand. So this is how we have to write Tikshnagni, Vishamagni, and Samagni. Then next topic will be Dosha Gati and Roga Marga. So if it is asked for 10 marks, these are all the points we should focus on. So Roga Marga. So we have to write what are the Roga Marga definition we have to write. So after that, 3 different types have been explained. That is definition of Shaka we have to write. Tvagadayo Raktamcha. So Rasa, Raktadi Dhatus, we are calling it as Shaka. Then next, we have to write about Marmasti Sandhi definition. So what are all the things we can include under the Marmasti Sandhi Roga Marga? Then next is Koshta. That the definition of Koshta we have to write that Rut Unduka Pupushasya. If you mention the shlokas, it is well and good. If it is not done, then you have to write the proper meaning of that shloka in Sanskrit. If you write in Sanskrit, it is well and good rather than English. Then we have to write about the diseases of Shaka Roga Marga. Then diseases of Koshta Roga Marga, which are explained in the context, and we have to explain the diseases of Marmasti Sandhi Roga. And very important point we have to mention here, the movement of the doshas from the Koshta to Shaka and the movement of the doshas from the Shaka to Koshta. Here different things have been explained, so that we have to elaborate with clinical examples. So if we explain that thing in Roga Marga, it is well understood. So that we have to write in the significance of Roga Marga. Yes, next will be Doshagati. So Doshagati, we are having different types. So here also there are different types, that is Urdhva, Adha, and Tiryagati. So we have to explain here with Urdhva Doshagati with example like Urdhva Amla Pitta. Then our other gati, we have to explain with Adoga Amla Pitta or Adoga Rakta Pitta like that. And Tiryak Gati, we have to explain with Tiryak Gata Rakta Pitta. So with Rakta Pitta is the best example for here we can give. And we have to explain with the importance of doshagati. So before administration of any medicine, we have to understand the doshagati and we have to give the treatment. So after that, we have to draw conclusion from each of this topic and we have to write. Then next topic will be Shoto Dushti. This is very important. That is Shravanat Shotamsi. That is which the channels which are present in our body, we are calling it as Shrotas. So the Acharya Charaka has given Shoto Vimana Adhyaya in Vimanasthana. So there he explains all the explanation which are related to the Shrotas. That is Iha Kalu Parinama Apadyamananam. So the channels, micro, macro channels which are present in our body. So all those things we are calling it as Shrotas. So Acharyas are telling that Shrotas are innumerable in number. But according to Acharya Charaka, there are 13 types have been explained, but according to Acharya Shushruta, 11 pairs has been explained. So this we have to write in a flow chart. So types of Shrotas, that is Bahya and Abhyantara Shrotas. So in Bahya, Navarandras we have to write, and in Abhyantara, 13 types according to Acharya Charaka, and 11 pairs according to Acharya Shushruta. So we have to write all those list. Then next comes is Shoto Dushti Karanas. So Acharya Charaka has explained beautifully in Vimanasthana, that is Aharascha Viharascha. So if we write that shloka with proper meaning, that is Dushita Ahara Sevana, Dushita Vihara. So these are all the things which will vitiate the Shotas. So that we have to explain properly. Then next, Samanya Shoto Dushti Lakshanas. There are 4 Shoto Dushti Lakshanas have been explained. So in that, first and foremost is Ati Pravrutti. So the best example we can give for, we have to give 1 or 2 explanation regarding that Ati Pravrutti. That is excess flow of anything from the body. For example, Atisara we are calling. Then Swasa. So normal Swasagati will be 12 to 16 per minute. So if it exceeds that, we are calling it as Swasa. So this is how we have to interpret clinically with the proper examples. Then next comes is Sangha. So this Sangha, we are calling it as obstruction. So how to understand this? So the clinical applicability. So these are all the basics of Roga Nidana, wherein we can apply to the second paper, that is disease part. So Sangha, Jwara is the best example, and Shakashita Kamala example, we can give n number of diseases for Sangha. Then in Vimarga Gamana, so Vimarga Gamana here, Chardi we can take it as Vimarga Gamana. Atisara cannot become Vimarga Gamana. The things which move in opposite direction, that only we can give for the Vimarga Gamana. Next is Siragrati. So Arshas, Arbuda, and different types of aneurysms, varicosity of the veins can be included under. So like this, you have to give different disease examples, so that the concept of Roga Nidana will be cleared. So then after that, you have to write the significance of that particular Shrota Dushti. Yes. Now the very important concept of Ayurveda, that is concept of Ama. So there are different things are there. So if it is asked for 10 marks, so you have to write about introduction, then different types of Ama, then Samanya Lakshanas of Ama, and interpretation of this Ama with current science. So like this. So this is an example how we can frame a LAQ question or answer. That is, first is definition. So Acharya have given the different definitions. That is Ushmanu Alpabalatvena Dhatu Madhyam Apachitam Dushtam Amashagatam Rasam Mamam Prachakshate. So this is one shloka, and different shlokas have been quoted. That is Amashayastha Kayagni Dorbalya Tapachitam. This you have to write, or either there are different definitions have been given by Acharya Madhavanidana. So very important definition which has been quoted by Acharya Madhavanidana is Amam Annarasam Kechit Kechittu Malasanchayam Pratamam Dosha Dushtim Kechit Amam Prachakshate. So the Annarasa which is vitiated for the first time, so that we can take it as Ama according to some Acharyas. Some Acharyas will take it as Kechittu Malasanchayam. So in Jalodhara and everything, we are telling the vitiation of the malas. So Pratamam Dosha Dushtim Kechit Amam Prachakshata. This is a very important quotation which has been explained by Acharya Madhavanidana. So this one you can write. The next very important is Aharasya Rasa Shesho Yo Na Pakva Agni Lagavat. Sa Moola Sarva Roganam Ama Ityabhidiyate. This is one. Then the properties of ama have been explained. That is avipakvam, asamyuktam, durgandam, bahupichilam, sadanam, sarvagatranam, ama ityabhidiyate. So these are all the things we have to mention in the definitions of the shloka. Next is samanya lakshanas of ama. That is Shroto Roda Balabramsha Gaurava Anila Mudataha Alasya Apakti Nishtiva Malasanga Aruchi Klamaha Lingam Malanam Sa Amanam Niramanam Vipareyaha. So when a patient comes to us, we have to evaluate with Sama and Nirama Lakshanas. So we must know the Sama Lakshanas of Samanya Ama Lakshanas. So whenever a patient comes to us, so if it is having weakness, balabramsha, heaviness in all over the body, then anila mudataha. Next, unable to do routine activities, improper digestion, excessive salivation. So if there is a constipation, so if there is loss of appetite, if there is clamor, so these are all the things how we have to evaluate when a patient comes to us. So this we are calling it as Samanya Ama Lakshanas. If these are the Lakshanas are present, then we are planning for Ama Pachanartha. So next very important definition is Sarvesham Roganam Ayam Karani Bhutam Ama Saudikam. So Ama is the one which is culprit for the manifestation of all the diseases. Yes, there are different types of ama have been explained. One is Jataragni Mandijanya ama. Second one is Datvagni Janya ama, and third one is Bhutagni Janya ama. So GIT level ama will be there, tissue level ama, and cellular level ama is forming. So next is Sa Ama Dosha Lakshanas. So it is for 10 marks I am telling now. So what do you mean by Sa Ama Dosha? Amena Tena Samprakta Dosha Doshascha Doshitaha. So this you have to mention. When Ama combines with doshas, so then it becomes Sama Dosha. So what are the, see here, Sama and Nirama, this flowchart we have to give. And these are the Lakshanas which have been explained in the classics. So when Sa Ama Vata is there, so Vayuhu Sa Amo Vibandha Agnisada Tandra Antra Pujanaihi Vedana Shota Nishtoda Kramasho Angani Pidait. So these are the Lakshanas of this Samavata. Then how to analyze that the Vata has become Nirama. So that is Nirama Vata Lakshanas. That is Niramo Vishada. Clearance will be there. Rukshata is increased. Nirvibandho. No obstructions will be there. Alpa Vedana. Viparita Gunehi Shantaihi. Snigdairyati Visheshataha. So if you don't remember shloka also, please try to write the words in Sanskrit appropriately. Then next, these are the Sama Kafa Lakshanas. That is Avilatam Tulatsana Kantadesha Avatishtate Sama Balaso Durgandaha Kshut Udgara Vighata Krut. So this is how we have to evaluate Sama and Nirama Dosha Lakshanas. This is Samapitta Lakshanas which has been explained. Next, you have to make a chart like this and you have to present very neatly. So with contemporary science, so what we can best take is partially digested food we can correlate, then free radicals, which destruct the cells. So autoantigens we can take. Then abnormal secretions of hormone also we can include under the AMA. Then biomarkers of the diseases can also be taken at AMA. AMA in different levels. So this is how we have to cover for 10 marks. Then if it is for 5 marks, then again go for S. If it's for 5 marks, reduce the content. Explain 1 or 2 shlokas of this AMA, then Samanya Lakshanas. According to the questions framed or asked, we have to answer the, even though you know the all the content. So if the question, if it is specific, answer to that specific only. Next topic is Dusha Dushti. So in this also different topics have been given. So here we can write introduction of the topic. Then here specific Nidanas, Dushti Lakshanas and Shroto Vidya Lakshanas of each Shrotas have been dealt in whole this Dusha Dushti chapter. Next we have to explain about the contemporary etiologies. So what is there in this means I will explain with an example. So that is the question is we have to write about the Dushti Karanas of Prana, Udaka and Anna, then Lakshanas with contemporary science. So this you have to write. So already it has been explained. Shrotamsi kalu parinama padyamananam dhatunam abhivahini bhavanti ayana arthena. So we have to write about the Pranamah Shrotas Mula, Pranamanam Shrutasam Hridayam Mula Mahashrutascha. Right. So next we have to explain about the Dushti Karanas. What are the Karanas explained? That is Kshaya, Sandharana, Rukshahara Sevana, Vyayama, Ati Vyayama, Vyayamat Kshuditasya. During hungry stage also if we do Vyayama, that will vitiate the Pranava Shrotos. Next it has been explained as that is Pranavaha Dushti Lakshanas, that is Atisrishtam, Atibaddam, Kupitam, Alpam, Alpam, Abhikshnam, Sashulam, Sashabdam, Uchvasantam, Drishtva, Pranavahini Shrotamsi. This we have to explain with example. Ati Shrishta Swasa, Ati Bhadda Swasa. Next, Kupita Swasa. Next, Alpa Alpa Swasa. If we explain these terminologies with example, for example, Atisrishta Swasa. So what do you mean by Atisrishta Swasa? Tachypnea. So in which condition we are observing tachypnea? That we have to give 1 or 2 examples. For example, bronchial asthma. Like that, if we interpret each and every word in this Dushti Lakshanas, the answer will be effective. Then same as that of Prana, we have to write about Udakava Shrotas. Udakavahanam Shrotasam Talu Mulam Klomacha. The Talu and Kloma are considered as Mula of this Shrotas. And the Dushti Karnas which are explained, it is there. Ushnahara Sevana, Ama, if Ama condition is there, so there also. Then Bhaya. Next is Atishushka Ahara Sevana. So these are all the things which will vitiate the Udakavaha Shrotas. Then Dushti Lakshanas which are explained is there will be a dryness in the Jiva, Talu, Kanta, Oshtabhaga and Pipasa will be there. So same way Annavaha Shrotas, Amashaya and Vama Parshva are the Mulastanas. Then Nidanas which are explained are very appropriate. That is Atimatrasya cha akale ahitasya cha bhojanat annavahini dushyanti vaigunyat pavakasya cha. So ati bhojana, akala bhojana, ahita bhojana and Agni Dushti are the causative factors for the vitiation of Annava Shrotas. So what are the Lakshanas explained here as Anannabhilasha, Aruchi will be there, Avipaka. Next, Chardi will be there. So these are all the Lakshanas which have been explained for the Annavaha Shrotas. Yes, this completes the Dushya Dushti. So like this also, all the Shrotases have been explained. It Shrotas Mula, Dushti Karanas and the Lakshanas. So try to go through it very properly. It's a question of must to know topic. Next topic which has been explained is Sthana Samshaya and Purva Rupa. Right. So what do you mean by Sthana Samshaya? Sanchayam cha prakopam cha prasaram Sthana Samshayam. So this we have to elaborate. This is one among the Shad Kriya Kalas, that is fourth Kriya Kala that we have to write. So what exactly happening in the process of dosha samorchana? So that simile, kinvodaka simile, we have to elaborate. So how the fermented this thing will evolve from the ball, the same way the doshas which are accumulated at their own site will start flowing, overflowing of the doshas will takes place. So this we are calling it as the process of dosha samurchana. Next is we have to write about the importance of sthana samshaya avastha, why it has been told. So that is, if we identify the lakshanas at fourth stage of kriya kala, that is purva rupa only, so we can prevent further stages of like vector and Vedhavastha. Yes. If that question only, if it is asked for 10 marks, what are the points should be written? Yes, definition of Sthana Samshaya will write. Then we can correlate this Sthana Samshaya with Purva Rupa. So here we have to elaborate points about the Purva Rupa. So what do you mean by Purva Rupa? Prag Utpatti Lakshanam Vyadehi. The signs and the symptoms which are manifested before the actual manifestation of a disease, we are calling it as Purva Rupa. Then second one is Pradurbhuta Lakshanam Punarlingam. So this is, also gives the same meaning. There are different definitions have been explained, which are easy for you. You can remember one or two shlokas and write the exact meaning of that particular quotation. Then next, it has been explained it as types. What are the types which are explained? Samanya Purva Rupa and Vishishta Purva Rupa. So what are the Samanya Purva Rupas? Common we are telling. So Shrama, Arati, Asya, Vairasya, these are all the common premonitory signs and symptoms. Then Visishta Purva Rupa, again it depends on the dosha pradhanyata. Jrumba Atyartam in Vatajajvara, right? Nayana Daha in Pitajajvara, Ananabhilasha in Kafajajvara. So like that, specific lakshanas have been given. Next, we have to go for importance of Purva Rupa. Why Purva Rupa why it has been explained? That is, so when a patient comes to us with a Haridra Varna, Mutra, so we have to evaluate, is it because of Kamala? Is it because of Haridra Meha? Right. So for the differential diagnosis of each disease, this Purva Rupa is going to help. So like this, you have to write. Next is a very important concept of this Roga Nidana is Samprapti. So what do you mean by Samprapti? Yes, it is one among the Nidana Panchakas. Introduction part, you have to write one or two lines regarding Samprapti. Then after that, you have to define the very important definition, that is Yata Dushtena Doshena Yatacha Anuvisarpata. So, yatra sangakha vignat vadi tatra upajayate. This we have to evaluate and elaborate it. When the vitiated doshas are circulating all over the body, when they find the Kavaigunyasthanam. So, Kavaigunyasthana, here we are calling it as immunological weak point. So, vitiated doshas will do Sthana Samshaya at Kavaigunyasthana and does the, after that, dosha sammochana takes place. After that, disease manifestation will be observed. So this is how we have to write. Next is enumerate synonyms. So jati, agati are the different types of synonyms. So these types have been explained by Acharyas. That is, Acharya Charaka has explained 6 types, but Acharya Shushruta has explained 5 types. That is Sankhya Samprapti. What do you mean by Sankhya Samprapti? The name only tells that 5 types of gulmas, 5 types of kasa. So this 5 is the Sankhya Samprapti of that particular disease. Next comes is Pradhanya Samprapti. What do you mean by Pradhanya Samprapti? The word only tells that Pradhana means main dosha involved in the pathogenesis of that particular disease. Like that, you have to quote. For example, Ama Vata, Ama and Vata, Rakta Pitta, Vata Rakta. So in that also there is one dosha pradhanya lakshana, like Vataja, Rakta Pitta. So like that. So which dosha is pradhana, that we have to elaborate neatly. Next comes is Vikalpa Samprapti. So this is a very important Samprapti Bheda, that is Vikalpa Samprapti, that is Amshamsha Kalpana of dosha. So in diagnosing a disease, so we are dividing, that is Dravyataha, Gunataha and Karmataha Vriddhi Kshaya of that particular dosha we are evaluating. So to evaluate, for example, in Vata Vyadhi, there are Tatra Ruksha Laghu Shitakara Sukshmaschalo Anilaha. So these are the gunas of Vata. So which guna has increased in that particular disease? So Ruksha guna has increased, Laghu guna increased. So to know that, this Vikalpa Samprapti has been explained. Next is Bala Samprapti. Again, it depends upon the kala, this factor, that is day factor, night factor, and food what we are taking, it depends on that. Then Kala Samprapti, Natta Dina Rutu, Bhukta Sharira, Vyadir Kale Etam. So this based on Kala, we are having Kala Samprapti. So Acharya Charaka has explained this Vidhi Samprapti, that is different classification, that is Nija Agantuja types and Sadhya Sadhyata Beda, like different types have been explained. Then very important aspect of this Samprapti Ghatakas. So this, there are 12 factors are there in this, that is Dosha, Dusha, Shrotas, Shrotadushti, Prakara. In that particular, if we explain that Samprapti Ghatakas with one example, it's well and good. Then after that, you have to write about the significance of Samprapti or importance of the Samprapti. Next coming is Rupa. So yes, Rupa, as it is explained, it is one among Nidana Panchakas. So there are different definitions have been given. That is Pradurbhuta Lakshanam Punarlingam, right? So we have to explain different definitions of, one or two definitions of Rupa with proper meaning. Next comes is different synonyms. What are the synonyms of this? Samsthana, Venjana, Linga, Chinna and Akriti. So Veda, again we have to go for flowchart. So this is Samanya Rupa and Visishta Rupa. So what do you mean by Samanya? That is common symptomatology. That is Svedavarodha Santapaha Sarvanga Grahanam Tata. So these are the Samanya Lakshanas which are observed in the manifestation of Jwara. These are Jwara Samanya Lakshanas. Next is Visishta Rupa. So Visishta Rupa we are calling it as Pratyatma Lakshana. Please remember, Pratyatma Lakshana is the one which is giving the disease. That is, for example, Budena Bahudrava Saranam. This Lakshana will tells us that it is Atisara only. So that is Prati Atma Lakshana. Atma Lakshana of that disease has been told in the Pratyatma Lakshana. That is, we are calling it as Pratyatma Lakshana. That is, next one is Panduroga. That is, so Alparakto, Alpamedasko, Nissaraha, Shitilendriyaha. When the person is having Alparaktata, Alpamedaskata, looks ill, and all the Indriyas are looking like loose, Shitilendriyata. So this we are calling it as Panduroga. So the significance of this we have to write, right? So after that, we have to differentiate between Vyadhi and Lakshana. So Vyadhi is different things are there, and Lakshana, what is that difference? We have to write in a flowchart. After that, we have to conclude. Yes. Next very important topic is Vyadhi. That is, different definitions of Vyadhi has been explained. That is, Vividam Dukkam Dadati iti Vyadhihi. That which gives discomfort to the body, we are calling it as Vyadhi. Then Dosha Dusha Samurchana Janita Vyadhihi. That is the one which manifests during the Dosha Dusha Samurchana Avastha. Next is Rogastu Dosha Vaishamyam. So in Vyadhi or Roga to manifest, so Dosha Vaishamyata is the prime factor. So what are the synonyms which are explained? That is Tatra Vyadhi Amaya Gada Atanka Jwaro Vikaro Rogaha. This you have to write. Then next, this is according to Mahavidyalaya. Then next we have to explain about Rogaha Papma Jwaro. This has been taken from Ashtanga Hridaya. So like this you have to write the different synonyms of Vyadhi with proper meaning. Next, we have to go for different types of Vyadhi. That is Ekabheda, Dvibheda, Tribheda. Next is Chaturbheda. Next is Saptabheda. That is Saptaveda. So Acharya Shushruta have given, and in this CBDC curriculum, Acharya Shushruta's classification of Vyadhi has been taken. That is Adi Bhala, or Sahaja and hereditary disorders we are including. Next, Janma Bala, Dosha Bala, Sangata Bala, Daiva Bala, right? Then next is Swabhav Bala. So all these 7 types of classification have to elaborate with examples. What do you mean by Dosha Bala? What are the examples? Kushta, Arsha has been explained. So like that, we have to explain it for 10 marks. Next is Dhatupaka. So in this also different entities have been explained. That is autoimmunity has been explained, hypersensitivity has been explained. So whatever topic is there, so that if it is asked for 10 marks, so we have to cover in this pattern, right? So what do you mean by Dhatupaka? So Nidra Nasho, Hrudistambho, Vishtambo, Gavrava Ruchi, Arati, Bala, Hanishcha Dhatunam Paka Lakshanam. So if these Lakshanas are there, that is Dhatu Paka. That is the disease is progressive. So that we have to understand. So this Dhatu Paka concept has to be explained with example. I will explain you now. So this is one topic which has been explained in Dhatu Paka. Right. So that is asatma or hypersensitivity. You have to write the definition of the asatma or the hypersensitivity. The reaction of the body to the various asatma bhavas can be taken as asatma or the hypersensitivity. So there are different types have been explained. Type 1 hypersensitivity, we are calling it as immediate allergy. Type 2 hypersensitivity, we are calling it as cytotoxic. Type 3 hypersensitivity, we are calling it as immune complex. Type 4 hypersensitivity, we are calling it as delayed cell-mediated this thing, hypersensitivity. So this how we have to write about the different types of hypersensitivity. After that, we have to explain one by one hypersensitivity lakshanas. So what best applied aspect we can take for this hypersensitivities? So allergic disorders, all the allergic disorders which are disturbing nowadays. So that is house dust, grasses, weeds, animal fur, feathers. Like this, we have to interpret that hypersensitivity topic. So hay fever, that is allergic rhinitis. Next, asthma can be taken as a hypersensitivity disorder, urticaria, angioedema. So there are different things are there. So this is how we have to cover the 10 marks and 5 marks questions. I think MCQ questions is taken by you people. So you will write it very neatly. So what I give message is that, so take home message for the students. So proper and repeated reading is required. So follow 3R concept, that is read. First and foremost is read the syllabus which has been given properly. Thorough churning of the syllabus should be done. Then after that, second point is recall it. Daily repetition is required. So make your own short notes. So prepare and recall that short notes only. Then repeat. So next is maintain time. Yes, this is very important. Yes, what you are doing is, yes, this Samprapti you are knowing very well. You go on writing and wasting the time over there. So yes, the specificity has to be there. So I have to write this Samprapti for 10 marks only. So it is not that I should write all the things whatever I know. No, it is not like that. So don't waste time in that. So attempt all the questions, try to attempt. So next point is underline the important words. Yes, to get good marks, so we have to underline very important words which you are feeling, yes, it is important. Yes, underline it. So like that, you have to present. The presentation of paper is very important. Use more of flow charts and bullet form. Don't write in paragraphs. So please write down point by point. So if evaluator, if they evaluate, so yes, this person has read very properly. So next thing is make your own mnemonics or a code words to remember. So yes, to remember shlokas or to remember different types, you have to make your own mnemonics or code words. And next one is good food, good mood, and good sleep. So this you have to maintain whole the session while preparing for the exams. Next, the very important suggestion what I can give is don't read during the previous night of your exams. Previous night is for to calm your mind. So just revise the points which have you have read all these things. So this is how you have to prepare for yourself. Then trust yourself. You know more than you think you can do. So believe in yourself, believe in your preparation, and do well. Yes, thank you. Yes, I would like to thank Jignasa Karnataka organizers for giving me an opportunity to deliver my views. Thank you.
Thank you, ma'am. We came to end of the session. We would like to extend our sincere gratitude to Dr. Mamatajbegaum Walikar, ma'am, for conducting an extremely informative and engaging session. We appreciate your dedication and passion for teaching, ma'am.
Thank you,
I would
ma'am.
like I would like to thank the team Jignasa for hosting this session and ensuring its smooth execution and making it accessible to students. We are also grateful for our participants for their participation. Thank you once again, ma'am. Have a great evening.
Thank you, ma'am.
Kiran, end the live.
Any questions?
No doubts were asked, ma'am.
Shall I log out?
The session is over, ma'am. You can log out, ma'am.
Yes, thank you, sir.